Rotator cuff injuries are a leading cause of shoulder pain and disability in adults. The rotator cuff, made up of supraspinatus, infraspinatus, teres minor and subscapularis, stabilizes the shoulder and allows smooth arm movement. Injuries can occur as acute tears from trauma such as falls or heavy lifting, or as degenerative tears that develop over time due to aging, repetitive overhead activity, reduced blood supply, or bone spurs. Peak CF screw-in anchor. Available in double and triple loaded configuration for various diameters. Dual-threaded anchors maximize cortical and cancellous fixation. With and without needle options for each diameter. Knotless Peak CF push-in anchor. Engineered for secure fixation, simplified workflow and confident outcomes. Peak CF push-in anchor provides quick and reliable knotless fixation. Anchor is made of Peak CF that is elastic, radiolucent, MRI safe and bone-like structure to give lasting performance. Position the patient in a beach chair position. Create portals to perform diagnosis, soft tissue resection and to smoothly access implants and instruments. Clear and prepare the rotator cuff footprint for anchor placement. Use an awl/tap for 4.5/5.5 mm peak screw-in anchor to create space for a 5.5 mm peak CF screw-in anchor on the superior facet of the greater tubercle. Alternatively, use awl for 4.5/5.5 mm peak screw-in anchor for soft bone or tap for 4.5/5.5 mm peak screw-in anchor for hard bone. Screw in 5.5 mm peak CF screw-in anchor into bone. Once the anchor is fully screwed in, remove the cap to release the suture and suture tape. Detach and remove the handle from the bone. Retrieve the suture and suture tape from the lateral portal using a suture retriever. Pass the suture and suture tape through the torn tendon using an Scorpion suture passer. Retrieve the suture and suture tape from the anterolateral portal using a suture retriever. Place additional 5.5 mm peak CF screw-in anchor similarly. Maintain 6 to 10 mm gap for pull-out strength. Retrieve suture and suture tape from different anchors via lateral portal. Use a 3.2 mm awl to create space for a 4.5 mm knotless peak CF push-in suture anchor. Load retrieved suture and suture tape into 4.5 mm knotless peak CF push-in suture anchor. Place loaded peak CF push-in suture anchor at bone hole opening. Tension the suture and suture tape to restore the tendon to its anatomical position. Release the suture and suture tape slightly to allow anchor margin. Insert the loaded anchor into the bone. Trim excess sutures using a suture cutter. Follow the same procedure with the remaining suture and suture tape. The rotator cuff repair using Peak CF screw-in anchor and knotless Peak CF push-in anchor is completed. After surgery, proper rest is the first step in recovery. Keeping the shoulder still allows the tendon to heal, and a sling is usually advised to support and protect it. As healing progresses, physical therapy is introduced gradually, starting with gentle mobility before moving to strengthening exercises. Regular follow-ups with your surgeon are essential to track progress and ensure long-term shoulder function. Remember, wear your sling, follow your therapy plan, and don't rush the process. Recovery takes time, but each step brings you closer to full shoulder strength.